My name is Amy Morales, and I'm a clinical diabetes specialist at CeQur. This video will guide you through how to use the CeQur Simplicity 2U 4-day insulin patch. Please follow along with the Ready, Set, Click 2U Quick Start Guide. Before we get started, here are some important reminders. Now let's get started with the Ready, Set, Click steps. The first step is the Ready step. In the Ready step, we ensure we have all the supplies we need in addition to preparing the patch for placement on the body. You will need a 2U patch packet. You'll need an inserter, a vial of U100 rapid-acting mealtime insulin, Novolog or Humalog, 3 alcohol prep pads. You'll need Count by 2 card as well as Change by stickers. Both of these can be found in your box of patches. The patch can be worn for up to 4 days. You will decide patch wear duration with your healthcare professional, and this is largely dependent upon how much mealtime or rapid-acting insulin you use on a daily basis. We're going to fill the patch to 120 units for a 4-day wear. The patch has a minimum fill of 100 units and a maximum fill of 200 units. So let's go ahead and get started by cleaning the rubber top on the vial of insulin that you have here. Now your insulin should be room temperature. If it's been in the refrigerator, it's a good idea to take it out for 15 minutes prior to using it in a patch. This helps prevent bubbling. So go ahead and open up an alcohol swab and let's clean the rubber top of the vial. Okay? Then we're going to go to the patch packet. It's important before you open your packet to check the used by date. Make sure it hasn't expired. Go ahead and peel the paper off the patch pack. And then remove the top tray, which contains the fill syringe and fill needle, and set that aside for a moment. Tip the container and let the patch fall into your hand. It's important that when you're handling the patch, you handle it more down toward the end by the window here, and not by the red cap or the blue cap. This will help prevent any accidental needle exposure. We're going to use these 2 tan buttons on the side to lock them out. So we're going to squeeze the buttons like this until they lock. There, mine's locked now. There is no set number of squeezes or clicks at this step. Each patch will vary a little bit. Just keep clicking until it locks. Now go ahead and take the patch and place it down inside the container. Set that aside for a moment. Now we're going to move over to the syringe and needle. Go ahead and remove those from the tray. Take the needle and twist it on top of the syringe. Twist it until it's tight. You're going to notice that there is a gap here, and that's okay, just as long as this is tight. Take the plunger, and in our example, we're going to be filling to 120 units. So take the plunger and pull it down to the 120 mark. In this case, that's 2 lines below 100. Each line below 100 is increments of 10. At this point, you'll want to remove the cap off of the fill needle. You'll take the needle and push it into the rubber top of the vial, and then push the air with the plunger into the vial. Holding the plunger in place, you'll flip it all over in a vertical position, and then you'll draw the plunger down to that 120 mark. You'll want to tap, 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 tap. Get any air or bubbles up to the top of the syringe. If you see any, go ahead and push the plunger back up, pushing the air back up into the vial, and then go ahead and draw back down again to that 120 mark. Once that's done, you'll remove the needle from the top of the vial pick up your patch inside the container, holding it with your thumb down by the window there, in place gently. You'll take the yellow needle and place it inside the blue hole all the way until it won't go any further. And then very slowly push the insulin with the plunger into the patch until the syringe is completely empty. Then remove the needle, and you'll place the syringe and needle in a sharps container according to your local regulations. Now the patch has the insulin inside. Go ahead and tip it again into the palm of your hand. Take it to a vertical position like we did before, and then squeeze the buttons one time. This will unlock them. You'll notice that they'll pop back out again. Now the next step is to look at the window here. We need to inspect to see if there are any large bubbles. If there are champagne-sized bubbles, pin-sized bubbles, you can disregard those. If there's anything bigger than that in the window, we'll want to get rid of those. I'm looking at my window right now and I don't have any bubbles in my window. So my next step then is to prime the patch, and I'm going to take the buttons and I'm going to click them 4 times to prime. 1, 2, 3, 4. Now, if I did have bubbles that were large enough to get rid of before I primed, I would want to tap the window, rock it side to side, and attempt to get those bubbles up to the top of the window right here to this little peak. Then I would click the button slowly until I see the air disappear. And then I would go ahead and do my 4 clicks to prime. Okay, go ahead and place the patch back in its tray for a moment. The next thing we're going to do is go to our change by stickers. We're going to count 4 days ahead in order to determine which sticker goes on the patch. These are nice reminders. You can look down at your patch daily and see, is it getting close to the day I need to change my patch? Today is Wednesday, so I'm going to count Wednesday to Thursday, Thursday to Friday, Friday to Saturday, Saturday to Sunday. So I'm going to look for Sunday PM on my sheet here, and I'm going to peel that off. And then if you notice here on the patch, there is a little circle on one end, it's dotted. I'm going to place my sticker right there in that spot. Now my patch is ready to go. It's ready to be placed onto the body. Go ahead and return it to the tray for just a moment. Okay, now we're done with the ready step. Now it's time for set. And this is where we're going to place the patch on the body, but first we need to select our site and clean it. Now the patch can be worn on the abdomen, it can be worn on the thigh, it can be worn more toward the back, and it can be worn on the back of the arm. The patch can be oriented both horizontally and vertically, depending on where you place it on the body. Remove any excess body hair from where the patch will be placed. You want to avoid lotion, sunscreen, perfume, medication around the patch area. We're going to be using 2 alcohol wipes to clean the skin. The first one lifts dirt and oils from the skin, and the second one actually removes dirt and oil from the skin, and this will help with adhesion. You want to allow the area to dry fully prior to placing the patch, and you want to avoid getting the patch wet for a good 3 hours after it's newly placed. And each time you change the patch, you'll want to rotate your site. Now let's talk about the inserter. I'm going to place my patch back down in its tray for just a moment. You will use the reusable inserter to place the patch on your body. Sliding the yellow safety lock unlocks the green button, and then pressing the green button inserts the introducer needle and cannula, which is a tiny soft plastic tube, into the skin. We're going to remove the introducer needle, and the cannula will remain in the skin, and that's how the insulin gets into your body. Okay, so let's load the patch into the inserter. the patch will go red cap down into the hole of the inserter, okay? It does not matter which way the blue cap faces. Then you're going to take both thumbs, one on either end of the lining, and you're gonna go ahead and push the patch down into the inserter. You'll notice you'll hear a loud click and the cylinder will pop out down here at the bottom. Do not unlock and press the green button until the inserter is against your prepared site. In a moment, we're going to expose the introducer needle. Do not point the introducer needle at your face or at other people to avoid accidental injury. That being said, let's go ahead and remove the blue cap in the lining. There are two pieces to the liner. There's a clear plastic piece and a white paper piece, and they will come with the blue cap. Don't pull too hard so that you dislodge the entire patch from the inserter. With your first finger and thumb, you're going to find the ridges on the top and the bottom of the blue guide cap. So reach inside, find those ridges, first finger and thumb, and gently wiggle the cap loose. You'll hear it unsnap. You'll gently pull it away and then out and straight up. And then this part here is trash. You'll notice now you've got the adhesive and the inserter needle exposed. And you're actually ready now to place it on the body. Okay, so now we're to the final part of the set step, which is actually placing the patch on the body with the inserter. So I'm placing on the abdomen today. I've already cleaned my area and it's nice and dry. So I'm going to take the inserter, place it on the abdomen with the yellow safety and green button looking up at me so that I can see what I'm doing. And then go ahead and place it flush up against the skin. And then I'm going to push the yellow safety and then the green button, and the patch will place on my body. It's a good idea to lay the hand over the inserter for about 10 seconds or so to allow the patch to settle and the adhesive to warm up to the skin. So count to 10. There we go. And then go ahead and remove the inserter from the body. And now all that's left to do is to remove the introducer needle from the patch. So you'll notice that there are two clear buttons, one on the top and one on the bottom. We're going to pinch those together and slowly pull the inserter needle out of the patch. Okay, and then that will go into a sharps container per your local regulations. Then just go ahead and lay your hand over the patch, help it to rest a little bit. Run your fingers around the adhesive, make sure it's stuck really well. And that completes the set step of placing a patch. Now we're going to move into the click step. We've done ready, we've done set, now it's time to click, which means we're going to be talking about dosing your insulin. So now is a good time to reference this card here, the Count by 2 card. This reminds you that each click of the 2 buttons gives you 2 units of insulin. I'm going to click both buttons at the same time. And if I need to deliver 10 units, I'm going to count by 2s. So I'm going to click and go 2, 4, 6, 8, 10. I've given myself now 10 units of insulin. It's important to remember that the first time you click the tan buttons on a newly attached patch, it delivers 1.7 units of insulin because 0.3 units fill the cannula. After that, the patch will continue to deliver 2 units every time you click until you run out of insulin, essentially. If the buttons lock during a dose, the last click of the buttons may deliver less than 2 units. So if you're uncertain about your delivered dose, stop and check your blood glucose in about 1 to 2 hours, whether you're doing finger sticks or using a continuous glucose monitor. You always want to make sure the patch is attached properly every day. So the last thing I'm going to demonstrate is the removal of the patch. You'll lift the adhesive and then go ahead and remove it just like a Band-Aid. And then the patch at this point can go into the trash. There are no sharps. Couple of safety features. Make sure, as I said before, to click both tan buttons to deliver your insulin. Clicking one button will not deliver any insulin. If the buttons lock, there's two reasons for this. Either the patch is now out of insulin, or for some reason the cannula is not able to deliver insulin. Maybe there's a blockage of some sort or something's up. The last click of the buttons, when they lock, may deliver less than 2 units. Make sure you remove and place a new patch at a new site. Continue with your current dose and give the remainder of that dose if you're stopped midstream. And then always check your glucose in 1 to 2 hours. And that completes the click step. You've just seen how to use the CeQur Simplicity 2U 4-day insulin patch. If you have any questions about the patch, please call CeQur Cares. For medical questions, please call your healthcare professional. Thank you for watching.